Did you know that 1 in 5 pregnancies end in miscarriage? Well, this is something we talk about all day with a lot of patients that come in to see us. So let's get to it.
Unfortunately, this is a month where we acknowledge and celebrate pregnancy and infant loss. And just like Dr. Franklin said, we see it every day in our office. And today, we're going to talk about the top 3 things you should know about early pregnancy loss. So, Dr. Franklin, we see this every day in our office, unfortunately, and it's one of the hardest conversations that we have to have with women. But one of the first questions patients ask us is, how did this happen? How do you counsel a patient when she asks that?
Well, I think that the most important thing is to reassure people and validate what is going on. A lot of the times people are concerned that they did something wrong, of course. And so there's so many different reasons why this can happen. The majority of the time, we think it's related to a chromosomal problem.
Mhm.
So the pregnancy has an extra chromosome or too few chromosomes. And so about 50% of the time, it's due to something outside of your control. And that's just chromosomal things that can occur.
I agree with you, sis. One of the things that I also use this time to address with patients is their overall health status. What other medical conditions do they have? Is there any concerns with things such as their blood pressure? Are they diagnosed or dealing with diabetes? Or do they have any other disorder, such as a clotting disorder? So I use this time to address other potential causes of pregnancy loss that they may not have even been considering. I also talk to them about other risk factors. For example, do they smoke tobacco? So I'm asking them about their tobacco use and offering medical therapy to reduce their tobacco use. I'm also counseling them about other drug use that may be occurring, such as marijuana use or other illicit drugs like opioid use disorder. That is something that is also a risk factor. You know.
Absolutely. And so these are factors that you're talking about that are modifiable.
Mhm.
And so there's something that they can do about those things, right? They can
Yes.
improve their diabetes. They can make sure their blood pressure is under control. How about advanced maternal age? You can't change that factor, unfortunately.
Yes. And that is a really difficult conversation to have because we have so many women who are have delayed their childbearing, which I understand due to whether it's work or school or advancing their professional careers. And so that is a more common conversation that we have, especially for women who are over the age of 35.
It sure is. And it's a good thing for society, right?
Yes, it
We're
is.
having less teenage pregnancies. Women in their 20s are living their lives. They're
Mhm.
having a great time. They're building their careers, going to school. And the 30s, that's the time where the majority of women are having their babies now, which is good for us.
Yes. I also use this as a way to get them back into care, right? Because a lot of times women may only come see us around a time where they're having a pregnancy loss. And so I use this as a way to make sure their overall health care is up to date. And so that I get them back into their routine care. So,
Mhm. I will tell you a story. I had an experience as well in
mhm,
my own reproductive years. I
mhm,
had 2 miscarriages. And my first miscarriage, I was so scared. I, of course, had all these questions in my head. What did I do? Did I do something wrong? And I had a really bad experience with the doctor. I was a
oh,
medical student at the time. And that is one of the reasons why we really take the time with patients when they come in with this loss. I have so much empathy and
yes.
sympathy, and my heart goes out to them because I wasn't treated that well when I
Mhm.
had a loss. So to tell someone, to validate them and tell them, you did not do anything wrong, you did not do anything to cause this, this was out of your hands, that really provides a lot of relief for people.
Yes. Thank you for sharing that story. Um, so many women are going to resonate with you when you speak to that because in those conversations, I always remind women talk to your loved ones, your support system, because you're going to be really surprised how many other women have been in this situation, but still have gone on to have successful pregnancies in the future. It's just we don't talk about it, right?
That's true.
Because it's one of those things we want to ward off. And if we don't speak on it, we hoping that the next pregnancy don't have the same outcome. And for those who are listening, it is very unlikely for that subsequent or that next pregnancy to end up with a miscarriage.
Yeah.
So I just always like to make sure. So thank you for sharing your story.
Yes, ma'am.
Yes.
Okay, Dr. Coates. Now, when patients come to see you and they have been diagnosed with a pregnancy loss, and they say, well, what's the next step, Dr. Coates? What do you tell them?
The first thing I do is just tell them we do not have to make a decision today. I am just there to show them support. I am there to offer them comfort because this is a tough time. And to get news such as a pregnancy loss and then say, I need a decision from you right now, to me, that just seems so insensitive. And so I first ask them, especially because if you're in my office and we're having this conversation, that means you're stable. And what that means is you likely aren't having any bleeding, most likely. You probably don't have any signs or symptoms of infection, and your vital signs, such as your blood pressure, things like that, are within normal limits. So that means we do not have to make a decision at that moment.
Mhm.
So it really depends on the setting that I'm meeting a woman and their symptoms. But often the time, this can be diagnosed in my office when someone just comes in for an ultrasound. So I'm just giving them information and the news that has occurred, and I say, we don't have to talk about everything today.
That's
because
right.
we don't.
Some people are not ready for it, first of all. Second of all, they may not even have their family there because they were
Yes.
expecting to come in for a regular OB visit or to get diagnosed with how far along they are. So they may not be mentally prepared to talk about anything. So I get that.
Yeah.
Taking some time is good.
Yeah, so I don't want to put all that pressure on them to make a decision right there. Let's get your family involved. Call that support person. Come back in a day or next week if we need to, whatever works with your schedule. So that's the first thing that I meet with women with. But then I tell them the options, right? So the first thing is we don't have to do anything, and that is called expected management, meaning allowing your body to pass the products of conception, to pass the pregnancy on its own time.
Yes.
And that is an option for women.
Absolutely. And the patient has to be comfortable with that.
Yes.
Some patients are not comfortable with that, but some patients want to have time. And you can let someone go through that expected management process for up to 8 weeks. That's a
Yes.
long time. But for some people, that's what they want.
Yes, some people need that time. Some people need 8 weeks. Other women that say, I don't want to draw things out, and I understand, and I have to meet women where they are at. So then that leads to two other options. That is medical management, where I could prescribe a medicine for them to take at home, or I could give it to them in the office or in the hospital if they're not comfortable giving it to themselves, and so that they can do it on their own time. And so I explained to them that that is a process where 85% of the pregnancy could be expelled, where they will not have to go on to have any other additional management. Sometimes that requires an additional medical dosing. Sometimes it's not just a one-time dosing of medication. It could be a second time dosing or sometimes a third time dosing. Again, meeting women where they at and seeing what they need. And then surgery. So I explained to the women that surgical options can occur from the beginning. If you are like, I want to complete this process as soon as possible, then I talk to them about surgery. And there's two main options that women have. That can be a surgical management option in the office. I don't offer that. I know you do.
I love
Yes.
it.
Can you tell them what you do?
Absolutely. So manual vacuum aspiration
Mhm.
is a procedure where you have a handheld device to perform a surgery that you would normally do in the operating room with a big machine. So there's an opportunity for you to do this in an office setting where your loved one will be there right by your side holding your hand versus going to the operating room where you are put under anesthesia and your loved one cannot go back there with you.
Yeah.
So sometimes it helps with your anxiety to do it that fashion when you're awake with your family surrounding you.
And I love how you bring up that option. I don't have the capability because we don't have the instruments to perform a manual vacuum aspiration, even though you trained me to do that procedure. But it takes the right person. It takes the right patient. Not every woman should be offered that, depending on their comfort, their anxiety levels, as you stated, how they tolerate pain or pelvic exams, because this requires a pelvic exam. And so that is one option. The majority of the surgery I do is in the operating room And that is a suction, dilation, and curettage procedure where we use a suction machine to remove the products of conception.
Absolutely. So, what I tell patients is that at this point, you are undergoing an event in your life that you have no control over. You did not ask for this, you did not expect it. But the next step, you have to have control. You need to have control over what happens with you on the next step. So you get to decide out of all those options. And that also helps people gain a little control of a
Yes.
situation that they feel so lost and upset about.
Yeah. It does give them that power back. That's why I put the ball in their court and I tell them, I'm going to do whatever I can to support you. As long as your body doesn't show any signs of an infection, as long as your body doesn't have any increase of risk for hemorrhage or bleeding, then we can give your body time and give you time to make these important decisions.
Absolutely.
Yeah. So, Dr. Franklin, we often give women the opportunity to make a decision that's best for them and their family. And once they make that decision and they are preparing for that next pregnancy, they often ask, what can I do to prepare for the next pregnancy or to prevent this from happening again in the future?
Of course. So that is, of course, one of the most common questions we get. And so you definitely want to advise someone keep taking your prenatal vitamin or start taking a prenatal vitamin with folic acid. Folic acid helps to reduce the risk of open neural tube defect or spina bifida. So that's important. Additionally, with doing that, you're going to hopefully develop some healthy habits, getting good rest, getting some exercise, getting into a routine, reducing your stress, eating well. So that is another thing that should be started when you're trying to start the next pregnancy healthy. Another thing is reducing all of those behaviors that we know can increase your risk of miscarriage, like maybe stop smoking, reduce your alcohol intake, and reduce your illicit drug use. And I know some people think, well, I had a drink on Saturday night. Oh my gosh, is this going to impact me? This is heavy alcohol use, heavy and regular alcohol use. Not if you have a drink on Saturday night because you're hanging out with your friends. So that's the kind of thing that you want to kind of temper when you are looking to have a healthy pregnancy in the future.
I agree with all of that. The other things that I remind patients to do is just have a conversation with their partner as well about their plans. Is this something that we want to try again now for the future? Do we want to give this some time so we can emotionally deal with this loss? Because this was a loss and grieving period takes some time, right? Some people deal with losses by giving themselves time to grieve and holding off on a pregnancy. And so then I'm seeing if I can support them in things such as contraception while they get that time to grieve. Other people would like to go ahead and try to move forward with pregnancy. And I say that there is really no waiting period. As long as your physician and you have documented the end of that pregnancy with your next period, you can try to get pregnant again. So I love all of the options that you stated for patients. And I tell them, call me with the next positive pregnancy test because I get that anxiety that you're feeling now, which can happen with the next pregnancy, because I'm going to get you in sooner so that I can assess things a little bit sooner. And for our listeners, this depends on your doctor, right? Resources are limited. When they can do ultrasounds are limited, but this is something that I do with my patients.
Yes. And how
Mhm.
about tracking your cycles?
Yes.
How about just knowing when your last menstrual period is so that you
Mhm.
can kind of predict how
Mhm.
far along you are? So that's really important. If you are going to actively try to get pregnant, you can actually make it happen. If you know when your last menstrual period was, you can actually predict when you are going to ovulate and when you're fertile. So I think it's a great thing to start doing is tracking those cycles.
Thank you all so much for tuning into this episode. It is Pregnancy and Infant Loss Month, and we know, as we described earlier, there's so many women who have experienced loss. Thank you so much again, Dr. Franklin, for even sharing your story with us. And for the women who are listening, if you have experienced this, we hope that you can learn something. So the main thing, three things we wanted you all to know is, how did this happen? The second important thing we wanted you to know is ways that it can be treated. And the last thing is, how do you move forward after pregnancy loss has occurred for the next pregnancy? So we thank you so much for joining us today. And please don't forget to like, comment, and subscribe. We want to hear from you to see what other content we can bring your way.